That seems a little strange. Unlike American culture, there's a lot of difference in between what we believe and what Hispanic culture believes, or even what we consider norms. Expression of griefs are normal for La Mujer relatives, but not normal for men to show their emotional forms of grief. Because outward the mourning, it's considered a time that the soul is set free, so it's not seen as a sad time necessarily. um, it's not uncommon for families to have their priest that come to the hospital and not use the hospital priest. Many times, unless a patient's very involved in a church in American culture, an individual would just talk to any priest. The church is such a strong foundation in Hispanic culture that their church is like their family, so they prefer to have their own priest there. It's not uncommon for Hispanic families to want to hear medical news before the patient, sometimes not even sharing the news with the patient. Although consent must come from the patient, and while they're in the correct state of mind, um, they do have the option to do this. Sometimes they want to break the news slowly, or sometimes the family doesn't want to tell them at all and allows them to pass peacefully without upsetting them. Points to consider. Always ask patients and families about personal preferences in regards to rituals and cares. Um, Never assume that one person's preferences are the same as the other just because they're Hispanic. After the patient's passed, the family may want to honor the person by cleansing their body. It's common to just send the CNA in there or even you in there to clean up the body and take out the catheters and do whatever may needs to be done. But allow the family the time after the patient passes to give them this time to honor the patient. Prayer is a large part of the end of life process for many Hispanic cultures. Um, just allowing them the time to grieve properly is important, and like I said before, the vital signs and bed changes and all that little stuff can wait. Give them the space and the time they need in order to provide them with the best care possible. Just a few fun facts I thought I would throw in there. Latinos are less likely than Caucasians to use hospice, which can lead to poor the lower control. Um, Pain medication, it's kind of a questionable thing in their mind. Not only that, hospice is a wonderful resource, but Hispanic cultures typically like doing stuff themselves. And with that, they don't want to use hospice, so they don't get all the benefits of pain control. Latinos account for 15% of the US population, um, and is projected to grow 30% by 2050. It's important to remember this because even if we don't necessarily want to become fluent in Spanish, we have to learn to respect others' cultures and their beliefs. So, learning a few things about the normal Hispanic beliefs is really important. In the US, the term Hispanic generally refers to Spanish speaking people from Mexico, Cuba, Central, and South America. I feel like we've used the term Hispanic a lot through our presentation, so I thought it was important to clear up what areas we were talking about. Here are our references and where we got all our information from. Thank you.